So I will be doing the chest exam on myself and just explaining it as thoroughly as possible because I do work in a hospital and I am self-isolating from my family and my friends. So I'm going to keep my distance rather than putting other people at risk. So to begin the chest exam, I would enter the patient's room, introduce myself, confirm their name and date of birth, inspect their level of consciousness, ask about the reason that they came in, and if it was related to the chest or heart, I would begin the chest and heart exam. I would place them in a relaxed, comfortable position with their hands in their lap, and I would begin with inspecting. So to inspect their anterior chest, I would look at symmetry of the thorax. So ribs are symmetrical, all going in the same direction. I would then check for the skin, color and intact, and then I would check their respirations to make sure that they are even and normal. After inspecting, I'd palpate the chest. So I would palpate all around the chest for any tenderness, lumps, bumps, lesions, change of temperature like sweating. And then while I'm still touching, I would use the tactile Fremitus technique where I would place my fingers on the chest while the patient says either blue moon or 99. And while they're saying this, the vibrations should be symmetric along the chest. So you should feel vibrations with the tips of your fingers. And then to continue palpating and checking for symmetrical lung expansion, you would go to the back, the posterior thorax, and place your thumbs at T9 on the spine, and you would pinch a small piece of skin in on the spine, and then you would ask them to take a deep breath, and your fingers should move away from each other to show symmetrical lung expansion. After palpation, you would percuss the chest. So you would go to the back again, the posterior thorax, and you would use the percussion technique all down the back. You would start at the apices, and then go all the way down to the bases of the two lungs. So you would go back and forth from side to side on each lung. So starting at the apices and then side to side all the way down to the bases. And you would be listening for resonance. So that would be normal to hear resonance. If you don't hear resonance, you may not hear it because of them being an athlete. So they have increased muscle mass, or in an obese person, they have increased subcutaneous tissue. After percussion, you would oscillate. So to oscillate breath sounds, I would place the stethoscope again, starting on the apices, which is C7 on the back. And then you would go to the bases of the lungs, again, side to side, back and forth, all the way down into the bases. So you would be listening for 3 different types of sounds, which are normal. So those include the bronchial sound, which is a higher pitched, and then bronchovesicular, which is a moderate sound, and then vesicular, which is a low pitched, but they're all considered normal, and that's what you'd be listening for. And then after the chest, you would then want to oscillate the heart. So to oscillate the heart, you would start with the apical pulse, which is also S1. So S1 would be the lub. And that would be found at the apex of the heart, which is opposite of the lung. So the apex is technically the bottom, base is the top of the heart. So my S1 is here. I hear the lub or the apical pulse. And then to find S2, you would move up to the base and you would hear the dub. And then to listen for further sounds, the aortic valve you would find in the left second intercostal space. The tricuspid you would find in the third intercostal. The pulmonary valve you would find in the right second intercostal. And the mitral valve you would find in the fifth intercostal space nearest the midline. Okay. And then after osculating the heart, you would want to osculate the carotid artery, which is in your neck. There are 3 different locations to listen to it. And you don't want to press too hard on the artery. Because you are checking for a bruit, and if you press too hard, you can create a false bruit. So first you would check at the angle of the jaw. And then at the mid-cervical. And then at the base. And while you are osculating, you would ask the patient to hold their breath. It'll make the bruit sound more prominent and easier to hear. So that's all the oscillation that you would do for the heart. And then after that, you would want to check the PMI. So to inspect and palpate the PMI, you would go to the 5th intercostal space. So in here. And you would palpate it with 2 fingers. And basically what you're looking for is any type of thrill or anything that doesn't feel normal. So everything seems normal on myself, which is a good thing. And that would complete the heart and lung inspection. Also, while I would be doing it on a patient, I would also just, while I'm looking at them and explaining everything that's going on, I would also want to inspect any body language that seems like they're struggling to breathe or they're uncomfortable and having a hard time performing the actions that I'm asking them to. So in other words, if I'm asking them to take a deep breath and I see jugular distension, that could be a sign that they're having they're using other muscles to breathe besides their lungs. Or like when I'm asking to take a deep breath and they're using all their shoulders to take their breaths. So I would also note that. And once I'm complete, I would ask the patient if they had any questions, and I would then document my findings and speak to a physician. Thank you.